Heart disease is often called a silent condition because many people do not notice any warning signs until a serious problem develops. But your body can sometimes give clues long before a heart attack or other major heart problem happens. Most people think heart disease only causes chest pain or shortness of breath. But according to experts from the American Academy of Dermatology, some warning signs can actually appear on your skin, feet, hands, and nails. These changes do not always mean you have heart disease, but they should never be ignored. Your skin is the largest organ in your body. Because blood flows through every part of your body, changes in blood circulation, cholesterol levels, or heart function can sometimes show up on the skin before other symptoms become obvious. One of the most common signs is swelling in the feet and lower legs. If your heart is not pumping blood properly, fluid can build up in the tissues. This can make your feet, ankles, and lower legs appear swollen. Some people notice that their shoes suddenly feel tighter than usual, or that sock marks stay on their skin for a long time. This swelling may seem harmless at first, but when fluid continues to collect in the body, it can be a sign that the heart is struggling to move blood efficiently. If swelling continues or becomes worse, it is important to talk with your doctor. Another warning sign can be yellowish-orange, waxy growths that appear on the skin. These growths are actually cholesterol deposits that collect beneath the skin. They often develop near the eyes, on the palms, or on other parts of the body. These deposits are usually painless. Because they do not hurt, many people ignore them. But they can be a sign that cholesterol levels are too high, which increases the risk of heart disease and stroke. For people living with diabetes, these cholesterol deposits may be even more important. Diabetes and high cholesterol often occur together, and both conditions can increase the risk of developing serious heart problems. Another skin change that deserves attention is the sudden appearance of clusters of waxy bumps. These bumps may look like a rash, pimples, or small growths. Some people think they are simply a skin irritation and wait for them to disappear. But these bumps can be caused by extremely high levels of fats in the blood, especially triglycerides. Very high triglyceride levels can increase the risk of heart disease and may require immediate medical attention. Your fingernails can also provide important clues. If the nails curve downward and the ends of the fingers become swollen, a condition called clubbing may be present. Some people are born with this appearance, and for them, it may not be harmful. But clubbing can sometimes signal a heart condition, a heart infection, or a lung problem. Because it can be linked to reduced oxygen levels in the body, it is worth discussing with a healthcare professional. Another warning sign can appear underneath the nails. Thin, brown, red, or black lines that look like tiny splinters may develop under the nail surface. These marks are known as splinter hemorrhages. Sometimes these lines are caused by a simple injury, but when there is no clear injury, they may be linked to heart infections or other heart-related conditions. They should be checked by a doctor, especially if they appear along with fever or an irregular heartbeat. Painful lumps on the fingers or toes are another unusual warning sign. These lumps may last for a few hours or several days. Although they often disappear on their own, they can signal an infection affecting the heart or blood vessels. Heart infections are serious and should never be ignored. Treatment often includes antibiotics, and in some cases, surgery may be needed. Early diagnosis can prevent severe complications. There is also a skin change known as Janeway lesions. These are brownish or reddish spots that usually appear on the palms of the hands or the soles of the feet. Unlike the painful lumps just mentioned, these spots are usually painless. Many people never notice them because they do not cause discomfort. But these spots can also be linked to infections involving the heart and blood vessels. Medical evaluation is important whenever these signs appear. Children can sometimes show warning signs that involve both the skin and the heart. One example is a rash associated with rheumatic fever. This condition may develop after a strep throat infection is not treated properly. The rash often forms pink or red ring-shaped marks with raised edges and a lighter center. The marks may come and go, making them easy to overlook. But rheumatic fever can damage the heart and may lead to lifelong heart problems. Another condition that mainly affects children is Kawasaki disease. Children with this illness may develop a rash, fever, and extremely dry lips that crack and bleed. Although the illness may improve on its own, untreated Kawasaki disease can damage the heart. Parents should pay close attention to these symptoms and seek medical care quickly. Early treatment can greatly reduce the risk of heart complications. While we are in the middle of the video, if you think this video is useful, click the like button and subscribe to my channel. It is a simple help to encourage me to make more videos. Many people are surprised to learn that cholesterol can actually be seen on the skin. Cholesterol is often called a silent problem because it usually causes no symptoms. But when cholesterol becomes very high, the body may leave visible clues that should never be ignored. Heart disease remains one of the leading causes of death around the world. The good news is that many forms of heart disease can be prevented or managed when found early. That is why paying attention to small warning signs can be so important. Some people experience traditional symptoms such as chest discomfort, shortness of breath, fatigue, dizziness, or swelling in the legs. But others may notice skin changes before these classic symptoms appear. Research continues to show that the body often gives warning signals before a major cardiovascular event occurs. The challenge is recognizing these signals and taking them seriously enough to seek medical advice. If you have diabetes, it is especially important to pay attention to these warning signs. Diabetes increases the risk of heart disease, and some skin changes may reflect both conditions at the same time. Research has shown that people with diabetes often have a greater chance of developing heart and blood vessel problems. Good control of blood sugar, cholesterol, and blood pressure can help reduce this risk. But even if you feel healthy, do not assume everything is fine simply because you have no chest pain. Many heart conditions develop slowly over years and may produce only subtle signs in the beginning. That is why regular medical checkups are so valuable. A simple examination, blood test, or cholesterol check can sometimes uncover a problem before it becomes dangerous. Healthy daily habits also play an important role. Eating nutritious foods, staying physically active, avoiding smoking, managing diabetes, and keeping cholesterol levels under control all help protect the heart. But lifestyle changes work best when problems are identified early. The sooner a warning sign is investigated, the greater the chance of preventing serious complications later. So, if you notice swelling in your legs, unusual growths on your skin, sudden waxy bumps, changes in your nails, unexplained spots on your hands or feet, or other unusual skin changes, do not simply ignore them. These signs may be harmless, but they may also be your body's way of asking for help. Your skin, hands, feet, and nails can sometimes tell a story about what is happening inside your body. But only a healthcare professional can determine whether these signs are linked to heart disease or another medical condition. Taking action early may protect not only your skin, but also your heart, your health, and your future. A small warning sign today could be an opportunity to prevent a much bigger problem tomorrow. If you think this video is useful, click the like button and subscribe to my channel. It is a simple help to encourage me to make more videos.